So this sphincter of Oddi dysfunction situation is not a very common one, but the pain and discomfort that these people deal with is significant. Like if you're hanging out with somebody that's having a sphincter of Oddi attack, you're gonna hear some cussing. You're about to hear some cussing. Get ready for some cussing. And when you hear them tell their stories, like in videos on YouTube and stuff, they're just in tears because this is just a life-wrecking situation for them. And when you research this topic, you read these articles that just seem like it's like, I don't know. So it's very hard to find some information or even an understanding of what might be going on when somebody is dealing with the sphincter of Oddi dysfunction. So in this video, I want to share some studies and some insights that could give you some ideas of what may be going on, along with steps you can take to try to improve the situation for you. Let's jump in.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So again, I'm not a doctor. I'm not giving anybody medical advice about their sphincter of Oddi dysfunction, but if you can understand what may be going on a little bit, it'll let you ask better questions when you're talking to your doctor. So I want to give you some insights here, and what we're looking at right here is this is our sphincter of Oddi. This is what's giving you so much trouble. And this comes off of the duodenum here, which is like the first 10 inches of the small intestine. Some people call it a duodenum, but why would you do that when it's so much more fun to say duodenum? So this comes right out of the stomach. This is where the food comes in and gets acidified, and then it comes down here into this duodenum. So this sphincter of Oddi here kind of helps to connect this biliary duct that comes down from the gallbladder, as well as our pancreas. The pancreas here is this chicken tender kind of looking thing here, and it has a lot of jobs in the body. This helps to make some hormones, like that we get this insulin and glucagon that helps us control our blood sugar a little bit, but it also puts out enzymes and bicarb. And bicarb is this alkaline substance, and it's meant to help us kind of neutralize the acids that come from the stomach, along with this bile that comes down. That also helps to neutralize acids. And this bile that's going to come down from the gallbladder helps to emulsify our dietary fats. And all of these things are really important for us to be able to access the nutrients in the food that we're eating. That's what we're supposed to do when we eat food. It's not just because it's delicious. We want to break it down and get the fuel and the nutrients out of that food. And most of the things that really help us do that successfully happen right in this area where this sphincter of Oddi is kind of hanging out. So when it's time for the pancreas to shoot this stuff out, and when it's time for this gallbladder to squirt this bile down through this biliary duct and into this duodenum area, both of those things come through this sphincter of Oddi. So when we're looking at situations where why would there be pain with just this little sphincter kind of situation? Well, we know that the liver makes this bile up here, and then it sends it down here to be stored in this gallbladder. And we all have heard that, oh, people can get gallstones that kind of float around in here, but they can also come up here and block this biliary duct. And when it blocks that duct, if the gallbladder tries to squirt this bile down there while it's blocked, it's going to create these contractions and spasms and just horrible pain. So we understand that, but that can happen down here too. So if something's blocking the function of this sphincter of Oddi, then all these things that are trying to happen can get backed up and create these pains and spasms and contractions and lots of cuss words. So that's what we're looking at when we're looking at what's going wrong with this sphincter of Oddi. So when we're looking at what could be restricting this sphincter of Oddi from functioning correctly, we need to understand that gallstones are a really big one. Not only can they block ducts here, but a stone can come down through this biliary duct and it can block the sphincter of Oddi there and restrict things from moving correctly. A person could also get polyps here in the gallbladder, where it's basically like a little growth that kind of sticks onto the side, the inside of the gallbladder, and it's not always a growth. Sometimes it's like a pseudo polyp, where it's just like bile that has become too thick and sticky and kind of forms into this little polyp and gets stuck there. But they can slough off at the side of the gallbladder and then end up coming down here and blocking this sphincter of Oddi as well. But beyond just the polyps, just having your gallbladder too much sludge, too thick and sticky to really move correctly, and sludge can kind of block this off from flowing correctly, and that can be just as problematic. And when someone is feeling pain, The tricky part is that it can be pain from something blocking this from working correctly, and it could just be the pressure from that blockage. Or some people believe that it could be enzymes that are creating pain, and maybe somebody dealing with this problem might have pain for different reasons. So basically this pancreas here keeps these enzymes in here in an inactive state. And when it's time, when food comes down here into the duodenum, then it squirts those enzymes out and everything gets activated by the bicarb that was in there, and then it helps us to digest and break down those foods correctly. But if something's blocking them from coming out and the pancreas is trying to send everything out, and maybe they get activated in the wrong place, if we have some type of enzyme that's made to break down starch, if that gets activated in here, that may not cause any trouble because there's not any starch in the pancreas. But if it's an enzyme that's made to break down protein, well, that's what our organs are made of. They're made out of proteins. So if there's an enzyme made to break that down, that could create some inflammation and some discomfort. So one interesting thing when we're looking at trying to figure out this sphincter of Oddi things, there's not a lot of research that really helps us understand it, but if we look at the connections and the associations between sphincter and Oddi issues and other issues, we can start to get some insights. So when we look at this University of Rochester Medical Center website to get some insights, who is at risk for sphincter of Oddi dysfunction? You're most at risk for this condition if you've had your gallbladder removed. Other risk factors for sphincter of Oddi dysfunction are having had gastric bypass weight loss surgery, being a female, I mean that's a little bit broad, don't you think? Being middle-aged, and having pancreatitis that keeps coming back. So if we're going to look at associations like this, let's look at this gallbladder removed first of all. So if somebody's had their gallbladder removed, now there's no place for that bile to be stored. But the bile could still be flowing down here kind of all the time. But the problem is that if someone's had their gallbladder removed, they usually have had it removed because their bile was not flowing correctly. It had become too sludgy, and because this gallbladder's job is to concentrate that bile. It stores it and concentrates it so when it comes down, it's more effective. The problem is there's a wide variety of issues that can make this bile become a little bit too thick and sticky to flow correctly, and if it's not flowing down when it's supposed to or often enough, it will just continue to concentrate in the gallbladder. That's its job, is to concentrate that bile. So if it's in there too long, it will concentrate too much, which can turn it into sludge and eventually even stones. So if someone's had their gallbladder removed, it's usually because their bile had become too concentrated. And then when they remove this gallbladder, a lot of times maybe that bile is still backed up in the biliary pathway. Maybe there's stones up here that have not been cleared out and are restricting things from flowing correctly, or maybe some of these stones are coming down and landing in this sphincter of Oddi. So that may be why there's such an association between having your gallbladder removed and having this sphincter of Oddi thing going on. But the biggest association, in my opinion, is this pancreatitis thing. And they kind of make it sound like, well, if you have pancreatitis, you're at a higher risk of having this sphincter of Oddi situation. And we'll look at this study here on sphincter of Oddi dysfunction and pancreatitis. And they say patients with sphincter of Oddi dysfunction were 4 times more likely to have evidence of chronic pancreatitis than those with normal sphincter pressure. So if people that are dealing with sphincter of Oddi dysfunction are dealing with pancreatitis as well in most cases, we can also get insights with associations with pancreatitis. And it seems that up to 70% of people with pancreatitis are either dealing with gallstones or some type of gallstone disease or alcohol abuse. And only 2% had it caused by hypercalcemia, hyperlipidemia, and different medications. And then 31% are idiopathic, which means, I don't know, it's idiopathic. I don't know what's causing the problem for you. But they also see this a lot with pregnancy, and if somebody's doing total parenteral nutrition, which is basically an intravenous way to give somebody nutrition. Maybe they have some reason that they can't really eat food, and they'll give them nutrition intravenously. We'll talk about that in a second. And if somebody has had major surgery, and that's so common that they call it postoperative pancreatitis. So when we look at this study here in the New England Journal of Medicine on biliary sludge as a cause of acute pancreatitis, when they went through all of the participants, they found that in this particular study that 50% of the people that were dealing with pancreatitis had the cause be gallstones, or some type of gallstone disease. And then 14% was alcohol abuse, and then 36% were the idiopathic, that they didn't fit into one of those categories. But when you broke down the, idiopathic category, you saw that about 74% of those individuals were dealing with gallbladder sludge. So they were dealing not with stones, so they couldn't fit into that gallstone category, but they did have the gallbladder sludge that we were talking about. So that's most people that were dealing with the pancreatitis in this study were dealing with it due to some type of gallbladder problem, whether it be stones or sludge. That's a lot. So again, we're talking about pancreatitis here, where maybe the discomfort is actually coming from enzymes that are being fired in the wrong place because this sludge is restricting things from coming out of that pancreas correctly. But again, with the strong association between the pancreatitis and the sphincter of Oddi dysfunction, and we can see how they both can have the same underlying causes, is the pancreatitis really causing the sphincter of Oddi dysfunction? Or is the sphincter of Oddi dysfunction really causing the pancreatitis? Or are they both being caused or have the ability to be caused by the same underlying issues? This inability for the bile to flow through like it's supposed to, or the transformation of that bile into either sludge or stones that block things from flowing the way that they're supposed to. All of these functions here are very important for the digestive process, and the body's ability to digest food correctly and access the nutrients in our food is very important for the body to function correctly. And this may be why this sphincter of Oddi dysfunction issue seems to show up about 4 years after a gastric bypass surgery for some people. You know, when you're going to do some type of gastric bypass, okay, we're going to make this stomach smaller and then we're going to send it down this way. And we're just going to skip all this other stuff that Mother Nature put there for who knows what reason. So we won't worry about that. We'll just skip it and bring it down here. Well, if you're skipping all of these other functions that are supposed to happen, is that going to hurt their feelings? I don't know, maybe these things don't have feelings, but it's probably going to cause some trouble. And that may be why you're seeing this, because this is what happens here, is when this food is acidified and it comes down here, what people are going to tell you is that cholecystokinin is what triggers this gallbladder to squirt the bile down, and then that cholecystokinin here in the duodenum is also responsible for triggering the pancreas to send all the good stuff that it's going to send out there. Well, here's the problem. This cholecystokinin is triggered by acid coming into the duodenum, or dietary fats or amino acids. So the problem is, to get amino acids to come here, we need to break them down with stomach acid. And it's very common for someone not to be making enough stomach acid for a wide variety of reasons. Millions of people turn off their stomach acid on a daily basis on purpose. So this is a very common thing. And when this stomach acid is not acidifying the food and coming down here, now we don't have the ability to trigger that cholecystokinin as much or as often. The only way we could trigger it without this stomach acid is if we ate enough dietary fats. So if this is not getting triggered, then the gallbladder is not being notified. Hey, it's time to send stuff down here. And now that gallbladder is going to hold the bile in there longer. It's going to concentrate it longer, which is going to turn it into sludge and keep it from moving the way that it's supposed to. Now, all these things are not being called on, and it appears that when they don't get called on as often, now you're going to slow things down, restrict their ability to move, and when they do get called on, well, now you got a whole bunch of trouble. So it doesn't seem that you need to have some type of bypass surgery if you're just not digesting your food correctly. If you're not acidifying things, then these things are not being called on as often, and then they're going to continue to do the job that they're supposed to do. I'm going to keep concentrating this stuff, and then we have the ability to create this sludge and all these other problems that can restrict this sphincter from operating correctly. This may also be why if somebody's using that total parenteral nutrition, where it's intravenous way of feeding somebody, commonly creates this pancreatitis issue because you're skipping all these digestive functions that need to trigger each other. So the things that seem to cause this trouble most often are estrogen going too high. Estrogen going too high has the ability to thicken up that bile, and that may be why we see this more often with females, and especially middle-aged females. A lot of times the body will raise hormone levels when things are not able to function correctly. So they're kind of jacking up these hormones to try to do a last-ditch effort to allow things to work correctly if the body doesn't have enough nutrients and everything that it needs to function the way that it wants to function. And these things seem to happen as we get a little bit older, and the estrogen seems to go higher, of course, in females. So that's one possible cause. Digestive malfunctions, like we talked about, if someone isn't making enough stomach acid or some other issue has thickened up this bile where it won't flow correctly, now that's going to have the ability to cause trouble further down the line. Everything is triggered by one thing before it. So when the first shoe doesn't drop, it might not be able to trigger some of these other activities, and that can create some trouble here. There's also an issue called a catabolic imbalance, where a person can kind of get stuck in the daytime breakdown state at the cellular level, the state that we're supposed to be in during the day, and they don't move into that anabolic rebuild and repair state at night. And that has the ability to kind of thicken up that bile as well, that can create those troubles. And what's interesting is they see this association with pancreatitis after a major surgery, and it was Dr. Emmanuel Rivisi who helped us understand that a major surgery seems to have a very pro-catabolic effect on the body, where maybe it pushes that person too far into that catabolic state and they don't move back into the anabolic state at night as well, and then that has the ability to thicken up this bile. And remember, this paper here on Sphincter of Oddi Dysfunction says cholecystokinin is released from cells in response to a meal, exerting direct hormonal effects on the sphincter. But it goes on to say, additionally, the sphincter is extrinsically controlled via parasympathetic intervention. And so what that means is that the body has this state where it moves into a parasympathetic rest and digest state of the autonomic nervous system, or the sympathetic fight or flight state. So when someone's stuck in this sympathetic fight or flight state all the time, maybe they're really stressed in their life, or their body is really stressed, but something's pushing them to where they're stuck in this sympathetic state, they might not be able to move into that parasympathetic state where a lot of these functions can happen correctly. So that may be part of what's restricting that cholecystokinin to trigger this sphincter of Oddi to go into operation. So is it a problem where maybe the food is not acidified and activating that cholecystokinin, or is maybe a person stuck in this sympathetic fight or flight state? I don't know. You know, there's lots of things that can go wrong, and it's going to vary a lot from person to person. But when we're looking at, okay, well, I see I have a mess, so what do I do? And I can't just give you, okay, take these steps and just do this stuff, because the answer is going to be different from person to person. But if there are digestive malfunctions, maybe there's not enough stomach acid, or maybe the bile is not flowing correctly. And I can put links in the description below for our videos on 10 signs of poor bile flow and 10 signs of low stomach acid, and you can watch those to see, okay, do I have other signs showing up that might indicate that one or both of these areas might be problematic. But if these are a problem, those things need to be corrected, and this bile would really need to be thinned out so that it's flowing correctly. Because somebody might see this and understand, oh, okay, I really need to acidify my stomach for this stuff to work correctly, and they'll take steps to acidify their stomach, but then that stomach acid is going to come down here and just activate this gallbladder even more. And if it's all blocked up, they could create even more pain just from that being blocked up. So we like to see people take steps to thin out this bile and get it moving as they're putting effort into fixing other sides of digestion as well. And there could also just be anatomical abnormalities going on that are restricting something from working correctly. All those things are possible. But when you're looking at the numbers in the studies where it's like 70% are having either gallstones or alcohol, and then the people that are not in that category, 74% of those people are having bile sludge, it just seems like this is a really big piece of information that we're not talking about at all. So is fixing digestive malfunctions, if they're going on with you, going to correct this sphincter of Oddi dysfunction for you? I don't know. If you test this out and you have other symptoms indicating that digestion may not be working correctly, and you take steps to improve those, let us know in the comments. Does it improve your sphincter of Oddi discomfort that you are having? Sometimes hearing from people can be even more valuable than just looking at numbers in a study. So if you need help figuring out these digestive issues, we have a totally free digestion course that'll walk you through figuring out steps on which aspects of digestion may not be working correctly and what steps can help you improve those. And I'll put a link to that totally free course in the description below. And for right now, if you want to understand how to thin out this bile and get it flowing a little bit better, you can jump over and check out our video on 5 steps to improve bile flow to see if any of those steps can get you moving in the right direction. I can't wait to hear about your results.